If you're a woman at the age of, you're still in your 20s, or let me say 25, 26, any of that, maybe till 30, 35, you have gone like 1 year without seeing your period, then it could be something called premature ovarian insufficiency. That is early menopause. Premature ovarian insufficiency happens when your ovary stop working, when they stop functioning before you get to the age of 40. So it leads to low estrogen, irregular cycle, and going for like months or years without seeing your period. That is what is called premature ovarian insufficiency. Now, this is your ovary stop functioning before you get to the age of 40, which is you are entering menopause early because your estrogen level is down, you are having irregular cycle, and you're going months, years without seeing your period. Now, when you are having premature ovarian insufficiency, you'll be noticing dryness, you know, dryness, low libido, difficulty getting pregnant, hot flashes. You will be experiencing menopause symptoms that women in their 40s and in their 50s are experiencing. That is what you'll be experiencing. Now, what is the causes why women start experiencing premature ovarian insufficiency? Number one is genetic factors, that is Turner syndrome. Number two is autoimmune diseases can cause it. Another thing is chemotherapy or radiation. People that maybe they have gone for chemo, they have done chemo, they have cancer, all of this, it can affect your ovaries. Now, ovarian surgery, maybe you've had surgery in your ovaries before, can also cause premature ovarian insufficiency. Now, lastly, one symptoms that can also result to this is severe infection. When you have infection that has not been treated, you don't treat your infection, you leave it, it has stayed in your body for a very long time. That also can cause premature ovarian insufficiency. And when you leave this untreated, it can lead to depression, it can lead to heart disease, it can lead to infertility, it can lead to something called osteoporosis, and also can lead to low quality of life. Like, this is what it will result when it is left untreated. Now, how can you treat this? How will you go about this? First, you have to go for blood test. You check for your FSH and your estrogen level. These two tests, that is what you're going to go for. Then you go for pelvic scan. Then you can also test for autoimmune diseases. Now, this blood test and this test, or this pelvic scan and all of that, you have to repeat it every 4 to 6 months. Like every six months, every 4 months, you will have to be going back for this type of test. Now, what are the treatments you have to go for? You actually need to work with your gynecologist, but you can also go for hormone. There's something called hormone replacement therapy. You can also be taking calcium and vitamin D. You go for psychological support and all of that, but you have to work strictly with you have to work with your gynecologist. Very important. Then, if you have tried all this and it doesn't work, then I will recommend you go herbal. Now, what kind of herbs are you going to take? That is when you now meet me and I will now tell you what to take. Thanks for watching.